So the cost of dental implants, lots of questions about cost and fees. So what affects the cost?
Yeah, it's probably the most common question.
Okay.
What I've done, I've broken it down to kind of 9 major things.
Okay.
Okay, there's definitely more than 9, but these are the most influential things for the cost. So the most, right off the bat, it's the implant type. Not all implants are the same. There's titanium implants, there's ceramic implants, there's long implants, short implants, thick implants, narrow implants. You can just imagine there are thousands of different types of implants.
Okay.
And they all vary in cost. And they're all specific to the individual that we're planning on putting implants in. So it's very complex. There's a lot that goes into these implants. So that's one factor. The number of doctors that are involved and the number of team members that are involved. Commonly these procedures, really commonly in the old days, it was you go see an oral surgeon, you go see a periodontist, you go see a prosthodontist. These are all different dental specialists in order to complete teeth in a day or permanent teeth that don't snap in and out.
Okay.
With advancements in technology and with lots of training, we're able to provide this all in my office in one shot. But this affects
So
the
you
cost.
do the surgery and you put the teeth.
Absolutely.
Okay.
Yeah,
Okay.
that
So
way
it's one doctor, one fee.
Yes.
Okay.
Which, as you can imagine, helps with that cost.
Okay.
The next thing that affects the cost is surgery. How many teeth do we have to take out? How many implants do we have to place? Do we have to do any gum surgery? Do we have to do any bone grafting?
Okay.
There's multiple factors there that will affect the cost when it comes to the surgery. The big lab bill. This is a big one. So the type of material we choose. Is it a denture? Is it plastic? Is it going to be a different material such as PMMA, which is a harder type of plastic? So what we use is the gold standard. It's called zirconia. It is the most beautiful radiant material we can do to create a beautiful smile. And guess what? It is rock solid strong as well. Yes, it's incredible. It is the way to go. Okay? The next thing that affects the cost is warranty and maintenance. So we actually provide a warranty, which a lot of people are shocked to hear. We provide a 1-year warranty after everything's installed just to make sure that it's functioning correctly. And then there's maintenance to it. Do I need to see you every 3 months, 6 months, 9 months? And this really depends on how well the implants are being taken care of and if we're seeing bacteria under your bridges. Okay, so that'll affect the cost. Then there's snap-in, snap-out teeth.
Yeah, you don't like snap-in, snap-out dentures. Why?
You know what? I don't like them because my patients don't like them. It's not necessarily me, but what we see with them is we see a lot of breakage. We see a lot of wearing down of the components. What we typically see is...
it's still a denture, though.
It still is a denture. Commonly, they still cover the palate. So tasting food... well, say goodbye to that. It's not excellent. It's a big blocky chunk of plastic in your mouth. But we can see wear and tear with these. They commonly have to be maintained, sometimes replaced. Patients just generally are not happy with them. So the problem with snap-in, snap-out is that usually these individuals end up in zirconia permanent teeth anyways.
They have to do it again.
Yeah, but they just spent all the money on the snap-in, snap-out prior to going to the zirconia. So it's not an ideal situation.
Is it easier to do? Is that why newer dentists do these snap-ins?
Yeah,
what's the truth about that?
In fact, early on in my implant career, what I did was snap-on, snap-out, and because it's easier. It's you need less training for it.
And you thought it was the best thing to do?
At the time, I did. Yeah, and there was nothing wrong with that. I just thought it was the best. I didn't know what I didn't know. But now with years of experience behind my belt now, I know that there's a better option. And I really don't offer snap-in, snap-out.
All right.
Okay. Experience and training. I mean, I could talk about this for days. I mean, I just love...
that affects the cost.
Yeah, it really...
you want to get it done right the first time?
Yeah, it really does. There's no cutting corners here. Training is going to result in direct results for my patients. I never stop training. There's always something to learn. Technology's changing all the time. It's always improving. These factors, these annual, you can call it annual maintenance on my part. I have to invest thousands and thousands of hours and dollars into staying up to date in order to deliver predictable results for my patients. As you can see, when patients call our office and ask for a cost, it's not an easy answer to give.
That's fair.
There's so many factors. So the best thing to do, come in and see me.
So no matter, if they want a real price, no matter what, they're going to have to be seen, get an exam by a dentist anyway.
Absolutely. get a diagnosis, an exam, have a discussion, find out your individual needs, and then we'll provide a cost, without a doubt. And it won't be misleading, which it can be over the phone.